I still remember it, and so we put down July because it was, we had to go to Good Shepherd, had their first case on June 29th. It's hard for us to reflect back on all these timelines, but, and then Karen and I went down there to help them do a fit testing for all of the staff. And I remember turning around and seeing this man, it was hot like today, and this man was standing at the window trying to look inside to see if he could see his wife. And you just think how empty those people had to feel as spouses or family members to only be able to look at people through the glass.
And then at a certain point during all of this, stuff like some of the public health measures like, social distancing or, mask usage and stuff like that became more contentious. And I'm wondering, is that something public health at a local level can ever fully overcome, or is that something that really goes beyond a local scale?
I think it goes beyond a local scale, and I think it's on a national scale. I just read an article about the attempt, the actions that are being taken across states in the United States that are removing certain capabilities from public health agencies to make determinations about mask usage or social distancing. And they're limiting the powers of health directors like myself or boards of health to implement, say, mask mandates or policies. I mean, the governor of Iowa did that, said you will not basically implement these mask mandates unless I say so. And some communities tried to do that, and it didn't go over very well. But I think it's going to be a national discussion for years on end on what authorities do local public health have or state departments of public health to otherwise implement some of these public health control measures to keep outbreaks from happening. Tuberculosis, whooping cough, pertussis, those kinds of things we can put controls in place to try to minimize spread, control outbreaks. But if some of those capabilities are taken away from us, it's going to tie our hands quite a bit.